My name is Amita Singh. I am a clinical professor in the Division of Infectious Diseases at the University of Alberta in Edmonton.
What is syphilis?
Syphilis is an infection that can be passed on from someone who has it to their partners by having sex with them, or it can be passed on from a pregnant woman to her unborn child during the pregnancy itself.
Will I know if I have syphilis? How will I know?
That's a good question. So they may not know if they have syphilis or not. The only way to know if they have syphilis is to get tested, and that's with a very simple blood test. And in fact, in the Northwest Territories, all pregnant women are tested for syphilis at 3 times during the pregnancy. Of course, they have to see someone in order to have those blood tests done. In some cases, people can have symptoms of syphilis. And so what the symptoms usually are is it can start off in the very first stage as a sore, which is usually on the genitals. Sometimes it can be on the mouth. And if that stage isn't treated, it can get better by itself. And then about 6 to 12 months later, people can have swollen lymph glands. And very occasionally in this stage as well, people can have what we call neurological symptoms. So for example, they could have trouble with weakness or numbness, tingling. They may have changes to their vision or changes with their hearing. So it's really hard to figure out if you have syphilis or not without having the test done.
What happens if I test positive for syphilis during pregnancy?
So fortunately, the treatment for syphilis is very simple. It hasn't changed since the 1940s, and in most cases, it can be treated with a single injection of penicillin. Don't be shy, get tested. We're all sexual beings, and it's okay. That means sometimes you're going to get an infection. We have the means to test and treat for them, so just go ahead and get tested.